friend of mine had access to some old prescriptions that his grandma had, and he would bring them to school sometimes, and me and my friends would buy them. And it didn't start out more than anything than just, you know, every once in a while, just something to do. It became an issue before I even had the chance to try to stop using it.
I had a good family, you know, my parents were together, they owned a business, family trips. I mean, for all intents and purposes, I had every opportunity to succeed in life. It's this constant, where's your trauma? Where's that trauma, that abuse, that rape, that, you know, that happened, that made you this way? And I keep insisting that there is nothing like that.
Whenever they arrest you, they ask you, you know, a number of questions. When you tell them that you need something because you're struggling with opiate addiction, and they, you know, that at that point, that's when they start the paperwork and start to, you know, do everything to get you enrolled in the MAT program. I was so relieved to find out that they offered Suboxone in jail, because from the past times that I've taken Suboxone, I know that it worked. Once I got the Suboxone, I was like, okay, now I can move forward with this.
The local jail, it's like a holding center, I guess. Now there, if you're on methadone, you can pay the methadone clinic to bring your methadone to you, but the moment that you go to the actual jail, that stops. They don't allow that there. It wasn't an option, so I had to fight very hard. I have letters from my doctor, I have letters from my psychiatrist, I have letters that say it's inhumane and dangerous for her to cold turkey detox anything more than 1 milligram a week. It's terrifying, it's dreadful, you don't eat, you're vomiting. Like literally you want to bang your head into the wall till you pass out. Like it is unbearable.
After I got the Suboxone, I started getting up. I was up every morning, and I would just start cleaning. And that was actually how I ended up getting into the worker tank, was because the guards noticed that I was getting up every morning and cleaning and just showing initiative. And I wasn't doing it for any reason other than the fact that I just felt better. So I ended up getting a job in the kitchen, and I wouldn't have been able to do that without the Suboxone at all.
You're sitting in a cell for 23 hours a day doing nothing with no treatment, which is obviously totally pointless if we're pretending that getting us better is the goal. I got lucky one time that I got arrested with Suboxone, my own Suboxone prescription on me. I had to renew the prescription through the jail doctor every month. And the nurse would come and say, how are you getting this? Because we only give this to pregnant people. You know, I don't know how you slipped under the radar, but you're not supposed to be getting this. And are you thinking of getting off of it? And we want to detox you. And I'm like, no, not now, not here, no. And again, a total fluke. I watched everyone else around me come in, kicking heroin, have to do it cold turkey, asking me how the hell I got it. I don't know. There is so much contradictory ways of dealing with it. If I want to go to a rehab, they charge my Medi-Cal for it, right? Because that's a medical issue, okay? So now they're going to say here that it's a disease. But at the same time, my disease is going to put me in jail. My only crime has been to get high and have a dirty drug test, which is a crime according to probation rules. I get it. If you're going to call this a disease and charge my Medi-Cal for it, why are you putting me in jail? You wouldn't do this for a diabetic or a cancer patient.
Within the very first day I got out of jail, like I literally walked from jail, I walked over to the pharmacy, and then I walked straight over to the probation offices. I'm still taking the Suboxone. I currently am getting services at behavioral health. I'm in an intensive outpatient program there. I have classes 3 days a week from 9 till noon. I really like the classes I'm taking there.
I go to court and I'm told, out of the blue, you're a work in progress, good luck with you. I almost felt abandoned, like, you know what I mean? Like, all the resources, the places that they could point me to for therapy or, you know, for all these things that I needed to complete, all of a sudden I don't have access to anymore. It is such a, like, a dichotomy of how you feel. Like, I'm so glad to be out of it, you know? But there's this free-floating, what do I do now?
When I think about my future, I feel positive. I honestly didn't think, once I had reached a point of what I call like no return with opiates, I didn't think that there was going to be any recovering from it. I know that I wouldn't have been able to get to the point I'm at right now without the MAT treatment. To not offer something like that in jail is like inhumane. We're criminals because, you know, we've broken the law, but we're not animals.
If I'm not able to stay away from the drugs, I know exactly how my life is going to end. Not many people know that. I do. If we're going to say that the true object is getting the addict better to a point where they are a contributing member of society, MAT needs to be an option.